Long time no see.
LJ, do you ever sleep?
Ed,
Hello, Ed.
sometimes, not a lot lately.
I thought I was bad at checking my emails all the time. I'm sorry I've missed some of them.
Don't even worry about it. It's a lot to manage right now, right? Especially for all of you who are seeing so many patients. I think we'll give to about 12:17 and let the room kind of fill up, and then we'll start. Does that sound okay to everybody?
Yep.
All right, perfect. Renee, I'm just speaking, but forwarding you things now. Okay.
Okie dokie. Don't you have to be out of mail jail to forward me things?
That's always the interesting problem. It's amazing how many people send like 10 MB giant things. I crash about 4 times a day.
And you crash for not cleaning out your inbox, or it can't be that.
Well, my inbox is pretty full, Bob, I have to say. But it's the really big attachments that sometimes.
Yeah. And then when you forward big attachments, that adds to everything too.
Yeah. All right. Thank you, everybody. If you just joined, we're just going to start at 12:17. We're getting a big group. I'm going to ask if you don't mind, just because it's hard because the screen keeps changing. And I just wonder if people don't mind, just so we know which practices were represented here, just throwing, your name and your practice, at least making sure that, we know which practices are represented on the call. That'll be really helpful to our team and following up with maybe those who weren't able to join too. So thank you for doing that in the chat. Awesome. All right. So we'll start. So this really is designed to be a conversation, not a presentation. We have talked a lot in the last few HP 1215 Wednesday calls about what's happening, our understanding, very clear understanding of the untenable volume of patients that you're trying to keep up with for those of you who are caring for children. But I think for our practices who are caring for adults, there's a high volume too. We talked yesterday about guidance that's coming out today at Monroe County Department of Health. Guidance was released this morning to schools. We will be forwarding that on to you this afternoon, along with some healthcare provider recommendations for how to triage and manage this. These like myriad of patient symptoms and presentations. And I will just reiterate one more time at the beginning of the call, the overarching goal of what we're trying to achieve and bringing both systems together with the County Department of Health, counties, departments of health in the Finger Lakes region, is to find a way to keep kids safe, find a way to get necessary testing done as efficiently as possible, but not at the cost of having children not have access to a healthcare provider who need it. So trying to be sure that there is still that frontline assessment by a healthcare provider, whether that is a nurse in the school, a nurse in your practices, to determine with some of the mildest symptoms if those kids can be sent on just for testing, at least, unless symptoms are worsening or that child is clinically not doing as well when they would come back to our practices. And there are centralized testing sites that are coming on board, not yet, but URMC, RH, Monroe County Department of Health, Wayne County Department of Health, the 2 pediatric independent urgent cares, those and some collaborative work with Rochester City School District. All of those areas are working to set up some sites that would actually provide some coverage and accessibility around our area. The goal is to not have patients be turned away, but clearly if someone is sicker, then, this would be kind of like coming to a lab station to get your sample done. not so much going in for an urgent care type of visit. We really want workflows to be managed by our pediatric practitioners and our family medicine practitioners, and at the same time, not completely burden you with more documentation, with more follow-up. We're also working with the labs in these systems to try to determine if there's a way for families automatically to log on to my chart, if it's within the URMC labs, so that they can have quicker access to their results while their healthcare provider would still get that. That's going to help turn things around where you're having to track down less labs. And in terms of turnaround time, I saw Miriam's question in there. The goal with all of this is to shoot for a 24-hour turnaround time in terms of once the lab receives the sample and the results go back out. I think we have to work on some processes in there because they do get messed up. And we want to be very attuned also to what are the workflows and processes supporting your practices. So if you're seeing a kid and testing, are we getting that same turnaround for the samples that you're sending? So that I just wanted to, there have been a few questions that people have asked me. I wanted to clarify a few things up front. One thing I wanted to clarify is that at least for Monroe County Department of Health, they have invested in some point of care PCR testing. It is not the Cepheid platform. I've had that question from a bunch of different people thinking that now the county would be competing with resources with the primary care practices. It is a completely different platform. So just wanted to reassure folks who are waiting for their own supplies that there's not additional competition for those. So I wanted to put that out front because that's a lot of the urgent concern I think that people have, and we want to listen to things, but we do, yes. I saw the Pathway Peds. Any point of care testing right now that is being allowed for schools has to be either PCR or nucleic acid amplification testing, not antigen, not home tests. Those are not allowed for schools. And that's very clear in the algorithm that came up from the state that's available from the state, but also reinforced by Monroe County Department of Public Health. So that was, I talked a little bit more than I wanted to. I wanted to just say one other thing is that I want to make sure that our AHP team who's on this call can also be thoughtful with you. Are there other issues besides COVID testing that are difficult things for your practices right now that are pain points? We want to be responsive and be thinking, aware and thinking with you about that. So I see I can't tell where there's questions in the chat and where it's just people appropriately introducing themselves. So I wonder, can somebody take a look and see if there's questions that came through?
There's a question from Dr. Ingarowski. Do providers need to write an order for testing? If there can be a health department order to do this, it would really help and not require our office to do so.
Yeah, Eric, we're working on that right now. That's exactly the sort of stuff, this is some of the stuff that in addition to getting staffing and making sure that things are stood up and really ready to go and be child friendly and also, easily accessible. That's one of the processes we're looking at right now. If it will require a provider order, we're going to try to make that as streamlined as possible where, it would be just something that would be faxed. For example, if you wanted to send something out from your office, it could be something that would be faxed. But I will know more details on that. And we will include, as these centers come up online, again, keeping in mind, these are different lab systems. These are different, health systems. We're trying to have as much uniformity as possible, but it's also probably going to look a little different. So we're going to try to explain to you both accessibility and hours and what the process is so you can tell your patients and you tell your staff appropriately. Other ones, Renee?
Yep, another one from Dr. Lewis. LJ, last week we were told we cannot send recs to UR urgent cares for tests only, but spoke with an NP who works there and says we still can. Clarification, please.
I love it. Okay, well, there you go. So I'll just be transparent. Renee and I circled back around with URMC urgent care leadership just yesterday to clarify, because I had heard the same thing from a provider. And they said, no, they cannot accept that. So I'm just going to say to you right now, in general, I would not send to the urgent cares just for testing. If if that ends up happening and working, that's great. But I think it's a process that they're sort of shutting down right now because they are so overwhelmed with patient volume. I don't know what else to say. I thought I had gotten the right answer on that one.
Sorry, I was just
It's just funny. I feel like this is sort of like, oh, I feel like every meeting I'm like, oh, okay. It's a great thing if they're willing to do it. Like right now, all hands on deck, right? But I think from a policy standpoint, they're moving away from that right now.
Okay.
So,
Sorry, go ahead.
no, go ahead.
Okay.
I saw a my chart access question in there. I was going to answer.
Right. Yep. From Men and Peds, can the private
Yeah.
practices help in any way getting patients signed up for my chart?
So Mend and Peds, love the way you're thinking. I asked that question yesterday and have been going back and forth, and I'm trying to get exactly that kind of workflow. Because if you're doing a swab in the office, if you can give that family the indication of how they can sign up for my chart, my understanding is it's once the lab gets entered into the URMC system, then they automatically could have access to my chart. So we're trying to work through some sort of instructions that you would be able to give to your families that would help in that.
Aaron Owens from Panorama made a statement that I've certainly heard before, and that it takes so long to get the my chart access set up. That it's set up far later than the results actually come in.
So I asked about that yesterday and was told that was not necessarily true. So all I can tell you is I'm still on this one. I'm saying that is the lived experience of people.
Mm-hmm.
I don't want to set you guys up for giving one other piece of information to your families, and that in the end just backfires and then becomes a frustration. So we'll only encourage that signing up of my chart if it really can be efficient. We have asked, it is my understanding if people, just to be aware, I know this doesn't help with trying to have families produce the documentation of the negative test result. And that is the key thing of what they have to have. But for positives, the lab does call the referring provider. So if for some reason you've had a positive that you've sent to one of the labs and didn't get a call, please let us know that. That's one of the things for anything that's going through the labs. They are calling on positives in order to try to expedite isolation and contact tracing.
Got a question. Having parents check my chart would be helpful, but if we've not received the result, we can't send it to the school. Do they still require proof of test? I think the answer to that one's a yes.
The school does. The parent has to have, or the parent or caregiver is going to have that. But if we can have that be accessed more directly, so it's not, I'm thinking with Mend and Peds, if there's some way where that family can have access to that test result and that decreases some of this burden of phone calling and follow up on your practices, that to me makes sense. You just really need to know the positives though, because those are kids you're going to have to see back and follow up, and you obviously want to know to reinforce how their family should be responding and how they're taking care of that kid and what to watch for.
Dr. Albert has a question regarding who's responsible for sending the letter to the school, because patients are calling asking about results that weren't even done at the office. They were done in urgent care. So yeah, who's responsible?
This is one of the big things that I think this is in some ways why the county health department is aligning. Their guidance never said there had to be a healthcare provider note or it had to be resulted by a healthcare provider. I think that became an interpretation. And in some ways, I think we were trying to make sure that the right thing was happening for these kids. So if they can print off of my chart or have that access, Genesis Peds is posting it right in there right now. They can take that themselves. You don't have to be in the loop. That's the goal. If they went to an urgent care, I don't want to call anybody out on this or whatever, but maybe let me know, like, is this a hospital urgent care? Is this well now? Is this, I think our pediatric urgent cares, the two independent ones, are very good about following up with families and getting them the test result. But if you guys have different experience, that might be helpful, because I don't want to make a global statement, that bad statement about urgent cares. But in general, I think the referring provider on that is the person who's doing the test should be the one who follows up. Verbal results should only be in the instance of positives. I'm seeing what Aaron just put in there. Really, nobody has time to put their staff on calling for negative results. So for URMC labs, they should be accessing through my chart. And we can make sure that they have that process set up. We will have that set up with the centralized testing. Well, now that's what I wondered. Okay. So Victor Health is noticing that well now is one of the urgent cares of concern.
There's a question about nurses are worried about the volume of calls. They're already overwhelmed with triages. I forget, it just means triages. Will school nurses handle most of the patients with mild symptoms?
That is the hope. So I will be honest, this is complicated because the county health department releases guidance and that's what goes to the schools. That guidance is very, it does not contain any kind of triaging recommendations. Because in general counties, my understanding from a lot of conversations is that that's not what they do. They need to be in line with what the state guidance is. So it's very much, indicating what you need to get back in, what sends you out and what you need to get back in. Please don't say to the county health department that I distilled it that simply, but that's how I think of it. That's why the schools reopening task force healthcare work group felt like we had to have some kind of a triaging mechanism. And this isn't evidence-based, right? But this is practical based on what you are seeing right now, that so many of these kids have transient symptoms or very, very mild symptoms, and that those could just get a test. And then if they're worsening or not getting better, then they come to you like it would be at any other time. Bottom line, if everybody's getting tested, we don't have to worry about spreading COVID, but we also need to be able to get these kids back in more quickly. So I don't know if that answered the question. We are releasing this guidance document, and I apologize that it didn't come out yesterday, but it's really important that this has the alignment from healthcare providers across the different systems and regions, and it is our hope that that will be lifted to the school nurses. We specifically wrote it to say that a healthcare provider assessment is indicated and RN assessment is appropriate because it's really a triaging function, and those are RNs at the schools. That would be a big help. And if you want to know, the big dream would be that the school nurses have some testing ability on site where they could do that preliminary testing for the low risk kids right there, PCR testing. There's a couple of pilots that Monroe County Department of Public Health is setting up now to do that, to see if they could lift that effort. Again, not with the same point of care testing supplies that you all have, but that's going to take a little longer. And so that's why we're doing centralized testing sites right now to give some kind of a pressure cooker release for all of you where you could send at least some of these kids.
Got a question from Stony Brook. PEDS are practices in Livingston, Steuben counties, and there are a lot of schools saying that a rapid test is sufficient. Any suggestions as to how we should handle this?
I think the best thing you can do is go back. I would encourage you to some of you have been sending emails, and I'll take those and forward them on to the schools reopening task force team, because I think that there may be an opportunity for that group with their relationships to have some influence with the various schools and county health departments. But the guidance from New York State is incredibly clear right now in this moment, unless something just changed in the last 30 minutes after I called to see if anything had changed, that antigen testing and that the home tests are absolutely not acceptable for return to school. So I think we have to get that messaging out. At the same time, I would say for some of the, while there's a pilot that's starting up in Wayne County to help support the testing of kids in school, the next step after a couple of these centralized testing sites are set up here is to look at what could be done in some of the other Finger Lakes region, because it's like an equity thing, right? It's that the problem is everywhere. This is not unique at all, as those of you who are from Livingston County or Chemung County or other areas, as you know. So really kind of working on that to the best of our ability. I think I'd refer back to the state guidance. I would not refer to Monroe County Department of Public Health guidance, because I think each county has their own commissioner, but they all are in New York State. The last thing I'm going to say is, I bet it's going to change. So I think just like hang on for a moment, because I think it's very likely that antigen testing is going to be added as acceptable. we've tried to outline this algorithm of care to point people to the fact that PCR testing is still best and highly recommended if you have a kid who's had an exposure, or if you have a kid who has loss of taste or smell, or some of the more severe symptoms, that still is the better test. So anything else in there, Renee?
There's a comment at the very end, Men in Pediatrics sharing a snippet from a school district in Ontario County, saying, "We will test teachers and students who develop COVID symptoms while in school only."
Yes. So you know what that is, right? That would be what the schools don't want to have, is that they're becoming a centralized testing site. And then everybody who's sick is coming to school. The goal is, if you're sick, you don't come to school. So I think that's what that message is. And I think it's a highly appropriate message. You don't want for families to suddenly be like sending their kid to school so they could get tested, because that's a faster thing and exposing more kids. So it's going to be a shared responsibility like it has been through the whole pandemic. And it's also going to be a little Wild West, because everybody likes to do a workaround when they're stressed and when there's not enough resources.
You're all caught up with the chat, LJ.
So the chat is quiet. Can we pivot a little bit away from COVID testing, if you would like? And I'm just curious about where the other pain points are. I wanted to say thank you to the AHP team who's here. You have our behavioral health team. You have Renee, obviously. Our care management team is present. Mark Cronin and Bob McCann are here and listening in. And I'm probably missing somebody else from HP who's here. Jim Wright, our CFO, is on. Our whole team, all of us, are very, very concerned about where things are right now. I know 18 months ago, we were terrified that the bottom was going to fall out because you weren't seeing enough patients. You weren't getting enough. This is sort of like the awful flip on this. What else? Where else are the pain points? What else can we be doing? And I open it up to the HP team too, if they have specific questions, but would love to have you. Feel free to unmute. Put your screen on if you want. If you don't want to, I understand. And I'll answer some of the things in the chat. So I'll put a question in there. How are you guys doing with the incredible amount of behavioral health concerns that you're seeing with kids and with families?
I'll speak. I always speak. It's becoming increasingly more difficult to get kids in to see people. You talk to Strong Behavioral Health, there's like a 500 patient waiting list, if not longer. The private people that we have in the community are also not taking new patients. It's overwhelming. And given the state of things, there's more anxiety with kids going back to school. I don't know what the answer is, but it is certainly a concern.
Thanks, Ed. Others? Genesis Pediatrics agrees. Any follow-up questions from the BHI or care management team?
I don't know that I have any questions, LJ. Really just interested again in hearing what the experience is. I know a couple of practices had talked about also just some of the pushback and the challenges that they've experienced from families, with adherence and compliance with regulation related to masking and testing and all of that stuff. So it's the kids sort of with, I hear from a lot of school colleagues that kids are struggling tremendously just trying to get reoriented and re-engage with the demand. So that's one part of the story, but also just how providers are managing some of the pushback or challenge that they're experiencing from families would be interesting to hear. Mendon Pediatrics has put in, they're definitely been struggling with significant increased parent volatility in the office. Our policies are helpful, but it does seem like they don't relieve worry. You want to say more about that?
Was that Mendon Peds?
Mm-hmm.
Mendon Peds, do you mind unmuting? Thanks. Me.
I'll go.
There she is. Hi, Jen. Great, thanks.
Jen.
It's my nurse manager putting that in, but I ditto that completely. Here, let's see if you can see.
Her mic's not working, she said.
So we recently have had a tremendous increase in just blowback from parents. There have been people yelling, screaming in our waiting rooms. There's been people stopping us in the midst of doing a test and storming out. It's been really, really challenging, really challenging.
Yeah.
And how do we deal with it? It's really hard on top of the patient volume that we're trying to see and everything.
I don't know how to give the whole community a dose of calm and consideration, but it does feel to me like there needs to be some better public messaging right now. Right?
I think so. I don't know if it's a misperception that they don't know how much we're struggling in general. We have a patient population that we've been very responsive to, and recently we've had to tell a lot of patients on any given day that they can't be seen because our schedules are full. And there's been a lot of blowback from that, and a lot of people angry at us. So.
Yeah. In your experience, I would say over and over and over again, it's not that, and that's not fair. I recognize families feel this is not fair, but it's not fair. And I love what Elizabeth Murray just put in the chat, which was super nice. Elizabeth, thank you. I mean, I think all of us who are parents do really appreciate everything you all are doing.
And LJ, I mean, I'm happy to try to use the platform however you all would like. I was interviewed yesterday for Channel 8, and I don't know if they ran the story last night, just asking about what should parents do with all these increased volumes. And so we did touch on this. Like I said, I don't think they aired it last night. I don't know if it got bumped, or maybe they'll air it today. Maybe it'll help a little bit, because they did specifically make a point to touch on the volumes are increasing, but the importance of the testing, and this is where we are right now. I'm happy to do more. I know the hospital gets very nervous of any messaging that might sound like the hospital is busy. They get very worried about that, but we could certainly get other primary care doctors on the news. Would be happy to cover this however you guys want. It's just always that balance of, we don't want people to be afraid to seek care, but understandably everybody needs to know what you guys are all dealing with. We're seeing it in the ED too. It's awful in the ED, and at least my shift ends eventually, so
Yeah.
I feel for you guys.
I think the news picked up on Dave Topa's tweet early last week about the increased volume. And the parents that I've seen are saying, I wouldn't be here. I mean, this is not something that I would come to the office for. Except now I have to, because I need to get back to school. So I think at least parents are understanding. We haven't had to turn anyone away, but that's only because I'm working until everybody is seen and taking care of notes until midnight. But it's not a sustainable pace. And I don't think I've talked to a practice in the area through any of the various platforms that is in any better shape. I'm looking to see if Kathy Goodfellow is shaking her head or nodding her head.
Genesis Peds.
We're actually working on a little note that we can put in the rooms. It just says, we understand everybody's angry. We understand these recommendations are not what everybody likes. And we're all stressed and we're trying very hard to get to you as soon as we can. So please be patient and please bring out your kindness and just a little injection of calmness, and let's try and get through this together, because we will get to you as soon as we are able to. We want to take care of you just like we always do.
Yeah, Dr. Goodfellow, I think that's a really great message. And I also wonder about how do you leverage your website with that same message, as well as if there's any texting that goes out to families ahead of them coming in, just so that they're not showing up angry and then reading the message, but really just as much as we can get that out there. I think that's a good vehicle as well.
I actually posted on our Facebook page a message on Monday morning. I think I was feeling a little overwhelmed and the staff was feeling overwhelmed, and just saying, we really are, like, we had doctors coming in on their days off. We're working through lunch, we're trying our best to get everyone seen. And it got a nice response. And I have a mom bringing us food on Monday, apparently, to say thank you. And I don't know if it calmed down the parents at all. My practice manager, I think, is on this call too. So maybe she has a better sense of what's happening up front. But I don't know, I think it made people feel a little bit better and realize. But just to what Ed said, the pace we're at right now, at least in our office, and it sounds like every office, is just not sustainable for us.
Do you think that with the ability, if we can get the school nurses triaging, so some of them are not coming your way, and if you have the opportunity to send some of these patients off just for testing with a lower symptom category, is that going to help? It's not going to help if you have to bring them all in still. I recognize that.
LJ, that's something that we talked about that on that call that we talked about last week. The thought of just having someplace else to go get testing is fine, but it can't be what will most likely happen, that we have to track it down and then send the paperwork into school. If there is some autonomous testing site where a school nurse can say, you're sick, but you don't need to see your doctor, go get this test. And then they get the results and we get the results, but we don't have to track it down. But anything that adds to our administrative burden is really not acceptable. It's not just the patient volume, it's the sending the notes to schools. And now that I've run out of reagent for my PCR, it's also, checking on my EMR several times a day and into the evening to see if I get any results, and then having to take care of a call to the patient and then sending the paperwork on. So, I hope I speak for every physician who's on this call. We can't absorb anything more that we don't get paid for. Let's put it that way, just to be blunt.
Yeah. I hear you.
And if I'm going to have to track down the paperwork, then I'm bringing them in, because I don't have the time to do stuff for free right now.
And that's the goal with these testing sites.
I think one of the difficult things, especially for us, is that we're having to contact everybody with every result. It's one thing if you only have to contact people with positives, but when you have to follow up with every result and document everything and send a note for everything, and you can't find where they're coming from, and that has just made it incredibly busy. And we had people having to go into e-record for every test result for the whole week while Rio was down. And so that was just
like
a crazy layer on top of that. So I would agree, it's just not sustainable.
So I want you to, I hope I know I'm not in practice now, but I totally know what you are saying. And we are absolutely trying to assure that we're not going to dump more work onto your practice teams, that we're trying to alleviate that as opposed to exacerbate it. So talking about reimbursement for 1 second. So one thing, I saw Eric Ingrowski a ways back had put something in about inconsistent reimbursement, but I can't find it now. Renee, do you see it?
I do. He was saying that it's there's some variation in who is covering variable insurance coverage for lab testing. Some cover in-office PCR, some don't, but we'll cover the same test at hospital labs. I mean, we know that is direct violation of what the feds are requiring payers to do. They are absolutely required to cover COVID testing from any licensed authorized provider, period.
Yeah,
I bring that up because it increases our nurses' workflow dramatically. Like we have a whole list of insurances we can do in-house, ones we have to send out, and it's just a mess. The nurses spend literally 5 or 10 minutes per patient trying to get all the correct documentation down because it's different ordering, whether it's in-house or send out, and it's just a mess. But if there's anything you guys could do as our liaison to the insurers to try to get things more uniform, but it's silly to cover a PCR at a lab when they won't cover it in my office and I can get it resulted quicker if I had reagents, of course.
Is this issue about the quad test versus just the straight COVID test?
Mostly the quad, but not only just the quad. Like for years, MVP won't cover RSV testing in our office, but I can send a swab out to the lab, but I can't get reimbursed for my in-office test.
Eric, I'm sure that experience is uniform with the other practices. I think, I'm just going to say, can you have your staff share that listing? Like, what is it? What are the ones that are flagging that your nurses are having to look at and that you do need to send? I don't know what can be done about that, but I would think somebody within the HP team could at least take a look at that with the insurers that we have some leverage with.
I think we have that list from Aaron.
Okay, we do.
Same
Awesome.
issue that Eric's talking about.
Okay, thank you.
Our big thing with the Cepheid platform has been not that they don't cover the test in that they reimburse us poorly for the test. So it's not economical for like United Healthcare, Fidelis, Blue Choice or Child Health Plus Fidelis to actually do the test in-house. You actually lose money by doing those tests in-house. So that's why we do the same thing. At Mendon, we keep a list and we only swab those in-house that we know will cover at a decent rate.
There's another comment from Aaron at the bottom. Does anyone at HP have a line in with Cepheid to get a better sense of how we're getting testing kits delivered, meaning more regularly, more aligned with the number of tests we're ordering on a weekly basis? Aaron, I can tell you that I know Cepheid is standing up a web portal to allow users to come in and see what allocation they'll be receiving. And that is also the issue, that these test kits are on allocation. So you're highly variable of what you're getting. But the hope is that with just better information flowing through this new online portal, you'll at least be knowing when and how much, whether we can dictate.
Renee, it's the same thing with the Roche Cobas, which is what I've used for years. And I've been on the phone with Roche, and they're saying there's a global shortage of reagents and testing kits. And I talked to my distributor and they're saying they're not getting anything. And when they do, I'm getting half of what I really need. So I don't know how soon that's going to be resolved, but it is tough. And the other thing that you have to take into consideration when you're talking about the test, and I don't know if Cepheid provides you with the collection media and swabs, but with Cobas, I have to buy the swabs and the media, and that can be very expensive and adds to the test. So I think Jen was the one who was saying that it isn't economical, and it really isn't. You sort of do what's right for the patients and what's right for the practice, but there comes to a point where you can't afford it.
I do know that there's some advocacy, very loud and direct advocacy at the level of the state and with some insurers to increase that reimbursement, because it is providing a very critical service in a public health emergency. And so I don't know where that will go, but I know that people with connections are doing that. Similarly, there's some of the same conversation around COVID vaccination, that even though the reimbursement is a little bit higher than for a standard vaccine, it needs to be a lot higher, especially as we're moving into this, the pediatric vaccination efforts and moving in towards more boosters. So I think I feel like there are good people that are loudly advocating for that, and some of that's coming from AHP as well. I know there were more questions, more topics that were being covered in there. Just looking back. So I'm going to recap a couple of things that I heard because we're sort of close to the end, and then I want to say what did we miss here? I'm going backwards from what we talked about first or last. I don't even know what I'm saying. We're going to enhancing the reimbursement around doing this testing, enhancing reimbursement around COVID vaccination. Those would be two key things that as much as we could advocate for and put our voices in with others, it would be important for your teams. Trying to assure some uniformity around what's being reimbursed, why that point of care would not be reimbursed when a lab would be reimbursed is ridiculous at this time. So trying to take a look at that as well. I heard we had the conversation about angry parents and the how your practices are having to deal with that individually. Some good ideas about utilizing Facebook or utilizing messaging in the exam rooms. But I love when Liz Murray stepped in and talked about how could we use some of the media coverage that GCH or the other hospital systems have been getting in this space to use that to really educate the community and try to create a little sense of calm. One of the things about these centralized testing sites, I want to be really clear, they're not going to be advertised to the public, because what will happen in that case is then you have everybody just going without a provider referral. It'll be a mess. But we'll make sure that all the information comes to your teams, to your practices, as well as to our school partners, so that children can be triaged appropriately. But I think letting people know that we're working together as a community to have the best and most efficient system we can at a time where everybody is working as hard as they possibly can. And we do want to keep schools open, like desperately. So Liz, maybe we can think about that a little bit. Maybe Jennifer Johnson can help with that a little bit too, and pull her in.
Happy to help.
All right, that would be amazing. And then I think we talked a lot about some of the things that are really key that I should be making sure when we're talking about these sites that are being stood up and the workflows, that we don't increase workflow, that we enhance turnaround access for parents and caregivers to be able to get their testing results without it all having to go through you all. And I just want to say thank you. I know you don't have time to even do this session. I know you didn't really have time to join yesterday. I know you guys are exhausted, and you're still providing such an exceptional level of care for the children in this community. You're still doing their preventive care as you can fit that in with all this other stuff, and you're doing their behavioral health care. And we are really proud to be part of the team that you are. I wouldn't want to be in any other community as a parent or as a pediatrician. So that would be my last comment. Mark, Bob, anything you want to say?
I also appreciate what everyone's doing. And LJ, I think you're playing a pivotal role in bringing the needs together in the community and reaching out, to Rochester Regional and to Mike Mendoza, and, certainly helping to have a unified voice in a lot of this. Some of the things we won't be able to affect, but some we will. But I can't tell you how much I am happy that I'm in Rochester with such dedicated people, who put patients first.
Okay. Please watch your messaging a little later this afternoon. There will be an email that will come out. I'm not going to say exactly when, but before the end of the day, right, Renee? We'll get something out to folks that have the recommendations for the symptom algorithm. And it will include the Monroe County Department of Public Health schools this morning. So you have both things so that your staff can be educated around that too. Keep coming back with your questions. We will follow up again next Wednesday. And as those sites come up, those testing sites, we're gonna get that information to you as they happen. So it won't be one big email, because I think they're going to come online at different times. But by Tuesday, I expect we're going to have more testing sites, and if they come up faster, we'll let you know. Thanks, everybody.
Thanks.
Hope you take care. All right.